When I was a young man growing up in central New York State, my uncle was a radiologist and worked in a small town, a suburb of New York City called Poughkeepsie. And I used to spend summers actually with my aunt and uncle, a couple summers in a row. And my uncle would take me to his office from time to time, and it was a formative time in radiology as CAT scanners were just starting to become more ubiquitous and well accepted around the nation. And he had one of the first CT scanners, and over the years brought in the MRI machine as well. So I remember just as a curiosity looking over his shoulder and looking at x-rays, and he would describe the findings to me, and those were the beginnings of my interest in human anatomy and medicine. We see patients with coronary artery disease, valvular heart disease, and thoracic diseases as well of the lung in particular, and the center of the chest known as the mediastinum. And so when I get a call with someone with one of those issues, I would go evaluate them and then perform the appropriate surgery based on their disease process, either coronary artery bypass grafting, valvular repairs or replacements, thoracic procedures like resections of tumors or masses in the chest. Well, I grew up in central New York, and of course I did a lot of my training on the East Coast. But you know, when it came time to join a group, you know, professionally, Dr. Daly had a need, and I certainly had the desire and the need to have a partnership, because nobody in this field can really do it alone. It requires a team approach and a partnership approach, and so I found a home with Dr. Daly. I enjoy all sorts of outdoor activities. I play golf when I can, not well, but I do it when I can and derive a lot of satisfaction out of that. I play tennis, I have kids. I spend a lot of time with my kids doing those activities and making sure they do their homework. And, those are some of the outside activities I have.